Welcome to tonight's presentation. I'm just going to get ready here, sharing my screen. Just some housekeeping items. Everybody who is on the webinar watching from home, you are in listen only mode. So I can't hear you and your cameras are off so nobody else can hear or see you. With regards to our presentation tonight, there will be the opportunity to ask questions. So there is a chat box. If you want to go ahead and find that chat box now, you're welcome to do so. Please post any questions that you have. I'm happy to answer them as we go along. Typically with the presentations, the questions can take up a lot of time and I'm happy to spend the time going through them. If they are not 100% relevant to the slide that we're on, I'm going to save them to the end. So you can post your questions as you go, but if I don't answer them right away, just know I will get to them at the end. Of course, for those of you who don't know me, my name is Dr. Breanne Kallonen. I'm a naturopathic and functional medicine doctor. I actually currently live in Canada from a province called Ontario, although we do help individuals around North America. What we are going to be covering tonight is why I believe blood work is so important, and we're going to go through what the difference is between optimal versus normal levels. Before we get started here, find that chat box and let me know where you are tuning in from. I'm always so curious where individuals are coming from, and while you guys do that, I'm going to figure out how I can go into presenter mode here, because this is not how large I want it. Ontario, Idaho, Ontario, Canada, oh, Regina, Saskatchewan, Phoenix, Arizona, Vancouver, Waterloo, so not too far. Amazing, amazing, amazing. So individuals from all over. This was a highly requested presentation, so it wasn't surprising how many we got tuned in this evening. I don't know how to make this presenter mode. Is that better? Can you guys see my screen okay if it's not completely zoomed in? Yes, yes, yes. Okay, amazing. All right. Let's dive right into tonight's presentation. So for those of you who are joining, you are definitely in the right place if you are interested in learning more about health. So the idea and the way I practice is really through education. I firmly believe that individuals, when they are provided with the right information in the right context, are capable of making the best health choice for themselves. Perhaps you've been told that your labs are normal, but you just have that gut instinct that something isn't right. So we're going to go through maybe not enough was run, or perhaps what was classified as normal isn't optimal for you, and we'll discuss the differences there. If you have a copy of your blood work, feel free to pull it out as we go and you can compare those levels. Again, this presentation is not to diagnose and treat you, but to give you an idea of trends and things to look out for your blood work. If you don't have blood work, not a problem either. You are also in the right place if you are looking to optimize your health and prevent disease. So that's one aspect that I'm really passionate about as well. It's not just to say, hey, you are healthy because you don't have disease X. I really want to make sure that you are in the optimal range and that we're monitoring you each and every year to understand when you're falling off track or what diseases are you perhaps at increased risk for. And you are also in the right place if you feel that your doctor has not run enough labs. I cannot tell you how many patients come to me and I say, okay, has your thyroid been run? And they say, yes, it's normal. Okay, when was the test run? 5 years ago. Well, that doesn't mean that it's normal now. And in addition, it doesn't mean enough testing was done. And we're going to really zone in on the thyroid and on hormones with regards to what does a full panel really look like. Have you ever been told your labs are normal and you feel like something's wrong, or you feel like you're being dismissed or not enough has been run? Does that sound familiar to you? Maybe just put a Y or a yes in the comments just to make sure we're all on the same page. I've got to find that chat again. Ah, there we go. Yes, yes, good. Okay, perfect. So who am I? My name is Dr. Breanne Kallonen. I practice functional and naturopathic medicine. My goal is to get to the root cause of your symptoms. I see symptoms, especially low energy, resistant weight loss, irritability, all of those things we are told, are common or part of aging. I see those as symptoms that something else is going wrong underneath. And we don't want to just mask the symptoms. So I understand when individuals come to me, they are at their wit's end. They've often been to many practitioners and they are really, really not feeling well. Really drained, it's impacting their relationships and their quality of life. So of course, I want to treat the symptoms. I want to get individuals feeling as best they can, as quickly as they can, but masking the symptoms is never the goal. We really want to look at the root cause. I am also the creator of the Metabolic Reset Program, best-selling author of the book called Wild and Free, which is available on Amazon. I have 2 kids, Aiden and Evelyn. And again, I believe individuals, you are well capable of making your own health choices when you are given all of the information in all of the right context. Patients that have seen me will know I'm not here to say you should do X or you should do Y. My job is to provide you with all of the information, the benefits and risks of each treatment plan, whether that's pharmaceuticals, natural supplement options, diet or lifestyle, benefits, risks, evidence to support. Maybe there is no evidence, but we want to inform you of that so you can make the choice with regards to what treatment is going to be the best for you. And I firmly believe that you can't manage what you don't measure. So I always have a large stack of blood work on my desk to go through because of how important I feel it is to monitor labs, repeat labs. It's not just enough to get a low level and start, low level vitamin D and start supplementing. You need to repeat it to make sure that your treatment is working. What we will cover today, we will go through the basic blood work that I feel should be run yearly. And this goes through what I run yearly on patients. Now, keep in mind that blood work, while there is a framework, things might be added or taken away based off of the signs and symptoms. So depending on your age, if you're on birth control or not on birth control, some of these labs may or may not pertain to you. We're going to go through what the lab markers means. We're going to talk about optimal versus normal ranges. You can screenshot these and review them after. You will also get a recording about 24 hours after this presentation if you want to look back to it. We're also going to talk about some functional medicine testing. So what do you do if the blood work comes back normal? There are other more comprehensive functional medicine tests that we can do that are specific to look at optimal ranges, and they're more sensitive. And we'll talk about some of those ones that we routinely run at my office. I'm going to share some resources in case you can't get access to labs where you can order your own labs from. And we're going to talk about how to optimize labs and how you can resolve your health issues. At the very end, fully transparent, I will be sharing ways that we can work together. I can appreciate individuals on here are coming for the value and the information and the education, and I never want you to feel like you're being sold to on a webinar. So I will let you know when we are shifting gears in terms of ways that we can work together. Some are interested. If you are here just to get the information and idea, amazing, take it. I will let you know when we shift those gears. The legal information that I have to say, of course, this is not medical advice. We're not treating, we're not diagnosing. It's educational purposes only. And while I am a doctor, I can diagnose and treat. Maybe I'm not your doctor, depending on where you're here from. This is also a broad overview. So really take the information, advocate for your health, and perhaps you find a practitioner who's in your area or virtually with myself where we can really dive in and review. Now, normal versus optimal. This is the very whole context of functional medicine. We know that there are normal ranges that will encompass majority of the population, and these ranges are established based off of polling individuals in the environment. Now, the problem is, are we truly getting normal levels from a healthy population? There was a statistic a few years ago, maybe 1 to 2 years ago, only 12% of North America is actually metabolically healthy. So we are classifying normal off of a not optimal patient population as it is. So these ranges, yes, it says, okay, you don't have XYZ disease, but it does not suggest that these levels are optimal for physical, mental health, or longevity. We also know that these normal levels can change over time. For instance, a number of years ago, the optimal range or the normal range for ferritin, a marker of stored form of iron, in Ontario has been significantly declining. It was 50, I believe now it's all the way down to 5. whereas my blood work from Saskatchewan doesn't have that range. So there is changes based off of where you live as well. And it just doesn't make sense to me why, you know, months ago, years ago, it was okay to be X level and now the value has just gone down. And we see that as well with hormones. As hormones are becoming less and less optimal, we just shift the range. We also have to be careful that normal levels does not mean that you're not at increased risk. For instance, when we dive into blood sugar management, one of the markers says that you're normal, meaning you don't have diabetes, but you're actually at risk. So you really need to have a look at it. Same with levels of inflammation. Recently, chronic low-grade inflammation has just become more and more prevalent. So now they made the normal range just higher, so more people are now classified as normal, but in small letters that will show you, it says, yeah, you're normal, but you're at increased risk of cardiovascular disease, which is the leading cause of death. So perhaps your doctor's office might not even call you to tell that, and being at increased risk for the leading cause of death, I feel you should know. So we'll dive into that. Does that make sense? Normal versus optimal levels. And if I'm going too fast, you can always put in the chat that I need to slow down. Essentially, our normal levels are not made based off of a healthier, optimal population. So now we're going to get into the nitty-gritty. Essentially, many labs will present the information in a structured format. So typically, the CBC and differential is always on the first page. So if you have to flip your labs to find that, that's okay, but I'm trying to make it go into order. So if you've run labs through Life Labs or Dynacare or Alpha Labs, they're typically the same. Saskatchewan blends it all over, and so does Quest. So we're just going to cover the hematology report right now, which is the CBC and differential. This is your white and red blood cells. So this report, the first thing I always look at is the white blood cells, the first thing there. Now, your white blood cells are made up of this differential. So the differential, where it says neutrophils, lymphocytes, monocytes, those are all the different types of white blood cells that make up the total. And of course, white blood cells make up our immune system. So we really want to look and say, okay, do we have an appropriate level of white blood cells surveilling our system to keep us from viruses and parasites and bacteria and all of the things that enter into our bodies? White blood cells, when they're high, it might mean that you have an infection, an acute infection, short-lived, you just got it. When they're low, they could be depleted from that infection, or you've had a chronic infection. High can also mean stress, allergies, dehydration, and low can also mean stress, nutrient deficiencies, as well as maybe your bone marrow is not making enough. So this is where we have to look at all aspects of the individual. How are they feeling? What is their health history? And what does the lab say, so we can distinguish what is going on? The one type of white blood cell that I really pay attention to is the one called eosinophils here. So as you can see, the reference range for eosinophils is quite low, and they should be low. They only come up in individuals who have significant parasitic infections or uncontrolled allergies. And even though majority of the individuals on this call are in North America, Canada, the US, and we think, you know, perhaps we are not exposed to those things, we have to remember where our food comes from. So I do definitely see parasites in my practice as well, and I'm always on the lookout for the eosinophils. Red blood cells, hemoglobin, and hematocrit, I kind of look at all of those into one category. Red blood cells, when they're low, might be that you're losing blood. When they're high, typically it comes from individuals with breathing conditions. So maybe sleep apnea or asthma or higher levels of testosterone or dehydration. So again, there can be multiple causes where you really have to look critically and figure out what's going on to each individual. Red blood cells and hemoglobin, when they're low, of course, we need to look at nutrient deficiencies. We need to look at the building blocks of the red blood cells, so B12 and iron. And we can also look at other aspects on the blood work to distinguish how is B12 doing, how is iron doing. And if those are okay, then perhaps we need to look at some of those other causes. MCV, this tells us the average size of the red blood cell. You really want your average to be right in the middle. So you have a mixture of small ones and a mixture of big ones. If you have low MCV, we typically think iron deficiency. And if you have high, we think B12 deficiency. Now, either way, so if you have changes on either way, it's not the goal to just say, oh my gosh, you need iron. Oh my gosh, you need B12. We have to go one step deeper and look at why are those low? Is diet a factor? You're just not getting enough B12 and iron in your diet, or are you not absorbing them? Do you have issues with your stomach acid? Do you have an H. pylori infection causing acid reflux? Are you on a proton pump inhibitor to reduce acid? And that's why you can't absorb things. So it's really important to look at the full picture, right? If you have low B12 or low iron, it's not just enough to say, we need to supplement. We really need to figure out why. Platelets, these are really important for helping you clot. So if you cut yourself, you really want to be able to make a scab. But of course, we don't want to overclot and increase your risk of things like heart attack and stroke. Sometimes we'll see platelets go up in inflammation. We'll see platelets go up in insulin issues, so blood sugar issues, and the hormone-based birth control pill can increase your platelets as well. They can be low in things like infection, issues with your liver, nutrient deficiencies, autoimmunity. I would say this is the most tricky part of this entire presentation, a little bit harder to understand the CBC and differential, and it's not as clear cut. So it does get easier the rest of the presentation from here. This really needs to be looked at critically if there is any changes here that we see on the CBC. Anemia. So this is where individuals get misdiagnosed or not diagnosed. If we look at the CBC, the clear definition of anemia is your hemoglobin is low. Hemoglobin's low. Now, you can have normal hemoglobin, but very, very low reserves. So ferritin, for instance, is the storage form of iron, or the reserved. How much money do you left in your bank? If we don't also test ferritin, if we're only using the hemoglobin to diagnose iron, you could be really, really, really low in your reserves and only, one menstrual cycle away from being anemic, right? So it's important to look at the ferritin as well. Now, ferritin has this huge reference range. So the stored form of iron has this huge reference range, 5 to 272. 5, like if you are below 50, you are going to experience issues with potentially brain fog, energy, hair loss. I really like to see ferritin more so around 50 to 80. Again, while supplementation can be helpful, we really want to look at why is the stored iron low in the first place. One of the things to remember, of a caveat to ferritin, is ferritin can be artificially raised when inflammation is present. So that's why if you're ever looking at an individual's ferritin levels, or you're trying to see how much iron do you have left, it's also really important to run the inflammatory markers to see if it's artificially just high. Ferritin, 80 or greater if you're having hair loss, at least 50. B12 optimal greater than 500, and iron is a reflection of how much iron is in the blood versus ferritin is in storage. So that is one that I really see a huge discrepancy in that optimal range. Now, why is iron a big deal? I have patients that come to me and they say, oh, I'm tired, I'm losing hair, and they always feel it's thyroid, which it definitely can be thyroid. But when I ask about iron deficiency, they're like, yeah, I've been iron deficient in the past. And iron's really important because it helps to make thyroid hormones. Iron's really important because it takes an amino acid that you get from proteins, tyrosine, and converts it to dopamine. That's your motivation hormone. So if you don't have good thyroid function and you don't have good motivation, what is that going to do to your mental health levels as well? So individuals who are struggling with low mood or feeling low energy, it's really important to have a look at your iron levels and not discount how important iron is. Iron also helps to carry oxygen around the body. So if you don't have enough oxygen getting to your brain. You can have that brain fog, low motivation, slow metabolism. In addition, I also see individuals building up more lactic acid with exercise. So now your exercise is not as good. Your lungs can't get as much oxygen, or feeling winded or short of breath. Really important to have ideal iron levels. Iron also impairs sugar metabolism, so blood sugar issues. Anyone with prediabetes, insulin resistance, type 2 diabetes, resistant weight loss, if you also have iron that is low, you need to have a look at that. There's never one cause for one thing. So really important, if you have low iron, figure out why and how you can fix it. Interestingly enough, having really high levels of ferritin also impairs your body's ability to manage blood sugar. So that is related again, when your body has more inflammation, that ferritin is artificially going to go up. Optimal ferritin levels, minimum 50 for ferritin. If you're experiencing hair loss, we want that ferritin over 80. And the eosinophils, that white blood cell, when it's high, is related to possibly parasites or uncontrolled allergies. Hope that helps. Is everybody in agreement that iron's a big deal? Really important. I feel some people, I don't know why they just don't value the importance of iron. And iron, we want to look at, you can absorb it better when you take your iron with a vitamin C. I find iron is better absorbed on an empty stomach, especially away from things like magnesium. The reason typically individuals are told to take an iron supplement with a meal is because it can upset your stomach. So if you take it before bed, hopefully you're sleeping. So if it does upset your stomach, you're not going to feel it. So I typically have patients, depending on their ferritin levels, take iron before bed, sometimes a second dose in the day, ideally with some vitamin C. And you could just have some lemon water. There's a great amount of vitamin C in lemon as well. Now, in terms of what iron is the best, some individuals really like to use more of the animal-based heme iron. The research is all on ferrous fumarate. I find ferrous fumarate, 300 to 600 milligrams, really does not upset the digestive tract. It definitely will make your stools black. And if you Google black stools, it'll say you're bleeding internally. You are not if you're taking iron. So important to consider that. Okay, we talked about low iron. The next one that is run is blood sugar. And blood sugar and inflammation, so blood sugar, inflammation, and cortisol are the most impactful. If you take anything away from this presentation, is really that you need to manage those things, because you think of your blood sugar floats around in your blood goes everywhere. Same with cortisol. It's so important that your stress hormone, your blood sugar, and your inflammation is under control, because they impact so many other things. Fasting glucose tells us what is your blood sugar at the exact moment when we did the blood draw. Hemoglobin A1C tells us on average, what has your blood sugar been over 3 months? Now, why is it 3 months? Because the average lifespan of a red blood cell is 120 days, so 3 months time. This is where the normal versus optimal ranges become really important. So if you look here, anywhere from 5.5 to 5.9 for hemoglobin A1C puts you at risk of prediabetes. But yet, you are not going to be called until maybe even 6.5 to say that there's an issue with your labs. So you could be at risk of diabetes, prediabetes. If you're not getting copies of your labs, this is a missed opportunity to make things better. Once you get to the point of diabetes and your blood sugar is really high, the risk is damage to your nerves, your eyes, your kidneys, and at some point in time, that could be irreversible damage. So we really want to intervene sooner rather than later. Now, typically, that's all that's run. Just your blood sugar and your average blood sugar over 3 months. They might say, go be healthy. That's typically how specific it gets. Come back in a year's time. No, we want to measure after 3 months' time of strategic intervention, and we want to figure out, why is the blood sugar high? There's genetic factors that cause issues with diabetes. We know that. But also there's nutrient deficiencies like we saw with the iron. Stress can be an issue, not sleeping can be an issue, inflammation can be an issue. So we have to take a holistic approach to figure out what's going on. Now, why is measuring the average sugar not enough? Well, let's talk about what insulin resistance is. When you consume breads, pastas, cake, cookies, fruits, vegetables, anything with carbohydrates in it, healthy or not healthy, your body's going to break down the carbohydrates into glucose or sugar, and that's the squares here, that enters into the bloodstream. Normal. Your pancreas is an organ, sits under your ribs, will sense the rise in sugar and produce insulin. Insulin is the key. We need the key to help get the sugars into the cells, kind of opens the door. This is great as long as the lock and key mechanism is not damaged. Insulin resistance, which precedes prediabetes, precedes diabetes, this can go on for a long, long time. Insulin resistance, you can think of it as the lock and key mechanism on the cell is broken. That lock is jammed. And it does not matter how many more keys or how much more insulin the body produces. It's not going to be helpful. We have to fix the lock. Now, the problem with having high levels of insulin is a fat storage hormone. It'll say, take all this sugar in the bloodstream and store it. Now, your cells are like, hi, we're still needing glucose, we need energy. So that's why cellularly you are starving. You're having the food cravings, you're having the sugar cravings, you're feeling really tired, you have the brain fog, but yet you have stored sugar, stored calories on your body in the form of body fat. You're just not getting the proper signals. Insulin needs to be low, or that fat storage hormone needs to be low for glucagon, your fat burning hormone, to come up. That is why when I run a blood panel, I want to know the glucose level and the insulin. Your glucose could be great, but how hard has your body had to work in order to keep it there? If your body's having to work really hard, then that's not ideal. And the reason it's not ideal is not only for increasing your risk of obesity, diabetes, cardiovascular disease, but also it can really interfere with your thyroid function. So individuals who have higher levels of insulin, we see issues more often with the functioning of the thyroid gland. We also see issues in terms of hormones like estrogen and progesterone. Patients with PCOS or irregular cycle often have higher levels of insulin, which we'll get into. Does insulin resistance make sense? Yes. And the importance of measuring insulin is because we can pick this up, and there's optimal ranges for insulin as well. So insulin, again, if you haven't consumed sugars, we want those insulin levels to be nice and low. So fasting, the ideal insulin levels really should be 20 to 40. We want it low. Insulin can come up after a meal. We want it to come up after a meal. That's perfect. It's really important we have insulin, but we just want it to come up in the appropriate amounts, and then we want it to fall back down. Typically for my patients, I'm running a fasting glucose and a fasting insulin. There is another test that I do absolutely love called the 2-hour oral glucose challenge test. If you've ever been pregnant, you might have done this test. Patients really don't like doing it. And I appreciate it because you have to sit at the lab for 2 hours and you have to drink a drink that doesn't really taste great, but it is a great test. Reason being, we get to see how your blood sugar responds to drinking the drink. So what we should see is after you consume the glucose, so down here at 0 is you haven't consumed the drink. 30 minutes, your sugar rises. 30 minutes after you had the drink, it rises. In response, the insulin should come back up. Then your glucose comes down because the glucose is getting into the cells. Many individuals will have this response in red where the blood sugar goes really high, the lock and key is not working, you're having to make more insulin. And look, this individual with the red line, at the 2 hours, their insulin is still really high. So individuals who have this picture, they might say, I am doing intermittent fasting, I am doing 16-8 or maybe 24-hour fast, and I'm just not seeing the same results. That is because it's taking hours longer for your insulin fat storage hormone to come down. Individuals that don't feel particularly well when they're doing intermittent fasting is probably because your insulin levels are up and you're not able to flip the switch to get the glucagon up so you can break down fats for fuel. Now, this can be treated, right? So insulin resistance has the genetic component to it and all the other factors that contribute to insulin resistance needs to be addressed as well. There are medications that work really well. There are natural supplements that work really well. And it's all about, here are the benefits and risk and potential side effects of each option. Here's the delivery method. Some are injectable, some are oral medications, some are supplements. Here's dietary and lifestyle. Of course, nutrition is going to matter. Sleep and managing stress is going to matter. But if you have the insulin resistance, the way I explain it is in terms of weight loss and energy, it's like you're pushing a ball up a hill. That first bit is going to be particularly challenging. And once we get you to the top, it's smooth sailing on the ride down. But we have to provide the support so it's not as hard for you to push the ball up the mountain. Okay, so we talked about that. We talked about the ideal levels for the glucose and the insulin. You can do sort of an at-home version with this. So if you really don't have access to a lab and you want to see how your body is responding, we don't really have an at-home insulin meter, although we have at-home glucose meters where you can prick your finger. So in order to mimic the drink, so the drink at the lab is 75 grams of sugar. You could have, and I feel awful recommending this, but you could have a McDonald's pancake breakfast with a small orange juice, all of the syrup, but no butter. That would be 75 grams of sugar. That's a lot of sugar. Definitely only for the purposes of this test. So you would measure your glucose at baseline 0, then you would eat the breakfast, and then 30 minutes later, 60 minutes later, and 120. So that could be an option as well. I don't know how much Coke, but you could also do Coke. Although if I had a choice, I would probably want to eat the breakfast versus the Coke. The idea is it needs to be mostly carbohydrates, not, you can't have lots of fats, you can't have protein in that because that will change the way that the glucose is metabolized. Now, when we look at insulin resistance, there are nutrients that impact insulin resistance, and they're quite significant. So going back to the iron, that's a big one. I see patients all of the time that are iron deficient, and they're finding their energy, their concentration, their motivation is really low, and they're also seeing resistant weight loss. So we want to fix that. Magnesium. Magnesium is one of the most common mineral deficiencies. It's so important for hormones, for mental health, for blood sugar management, for weight management. It's just a key one that so many individuals are missing. Now, it's not that you have to supplement with all of these, but I would look at what are the iron-rich foods, what are the magnesium-rich foods, how can you incorporate more of those into your diet? Selenium and zinc are other ones, and selenium and zinc are also really important nutrients for the thyroid gland. Selenium you can get from 4 to 6 Brazil nuts a day if you like those. Zinc, pumpkin seeds, about a tablespoon of pumpkin seeds. So if a Brazil nut pumpkin seed mix is something that's pretty easy for you to add, almonds are rich in magnesium, so perhaps that could be something that you include as well. Great options there. Here is an example of a multivitamin that I created. And the reason I created this multivitamin was to address those nutrient deficiencies that I see. Now, I find my patients have a really hard time opening multiple bottles, and I know it's really like you need this and this and this and this. I tried to put everything in one supplement, which is why it is 5 capsules. So it's higher than probably would be most ideal. Although in order to get the appropriate therapeutic levels, you do need that capsule size. So if you are on a 1-a-day gummy multivitamin, you're probably not getting adequate levels. In addition, because we've put so much into this vitamin, it also is approved as a prenatal as well. Now, this has the iron in it. So for anybody who is not iron deficient or has high levels of iron, this is not going to be appropriate for you. So this is where it's always looking at what is going to be the best for you. But in general, a multivitamin can be a great start if you're feeling that your nutrition is lacking. Next up is inflammation. Inflammation is one of my favorite markers to run because it is so important for prevention of cardiovascular disease And I feel that it's actually more important than the cholesterol levels. Cholesterol is important, but cholesterol typically comes up in a response to inflammation. So when we think of a fire, if you were just an observer of fires and you've never seen a fire before, you might always see fire trucks associated with the fire. Those fire trucks are not bad. They're coming to help. That's kind of what the cholesterol is doing. There's a fire, there's inflammation, and the cholesterol is just coming to repair the arteries. But unfortunately, because it's in the it's in the right place, but it's getting a bad reputation. Cholesterol is not necessarily bad. We have to look at the other markers in context and what your overall risk factors are. Ideal C-reactive protein or ideal inflammatory levels are less than 1. Now, we have to look at what the labs did recently. CRP now, the normal range is less than 5, but it says here a CRP greater than 2 is risk enhancing factor for cardiovascular disease. Cardiovascular disease is the #1 cause of death. So if you have a CRP that is a 4 or a 5, you're not going to be flagged for that. It's going to be normal, even though you are at significant life-enhancing risk for cardiovascular disease. So that is important to look at. Individuals who have higher levels of inflammation, it's important to try to find that cause. So we don't want to be using natural supplements as Band-Aid solutions either. So we don't want to say, oh, just take a curcumin or a turmeric to reduce inflammation. We want to look at where is it coming from. Are you over-exercising? Are you having a lot of processed foods, alcohols, and sugars? Are you dehydrated? That creates inflammation in the body. How is your digestive health? Are you having pain anywhere? Are you having stomach pain? Are you having joint pain? Is it possible that you have an autoimmune condition? All of that can raise inflammation in the body. So it's always important to try and figure out where it's coming from. Definitely, diet can contribute as well. So looking at, do you have anti-inflammatory oils? Are you eating fatty fish and nuts and seeds? Or are your oils coming from processed foods or deep fried foods? It's really important to try to avoid heating oils if at all possible. Even the healthy oils, extra virgin olive oil, avocado oil, if you heat them at really high temperatures, they become more pro-inflammatory. So what you can do instead is cook and saute things with either water and spices or a vegetable broth or a chicken broth. That's one of the things that if you can get in the habit of doing that, it can be really beneficial. It's not that oils are bad, it's not that fats are bad, it's when we heat them that it becomes the problem. Homocysteine. This is another marker that predicts cardiovascular disease. So I always want to look at homocysteine levels and I want to look at inflammatory levels. Now, some individuals have raised homocysteine and that causes damage to the arteries. So it's really important to have a look at this. Now, genetically, we know that cardiovascular disease has a genetic component, and this could be coming from the homocysteine. Genetically, some people have a really hard time with B12, B6, and folate. So this would be genetic SNPs like MTHFR. We're not going to go into genetics too much in this talk, but if you have your 23andMe genetics or you've done your genetic reports, if you have issues with B12, B6, and folate, it's really important to check all of your vitamins and make sure they are in their active forms. So you want to see methylcobalamin for B12, or hydroxycobalamin, or adenosylcobalamin. For folate, you want to see folate, not folic acid. So that's why we've made sure that anything in my product line is always the active form, because we don't know if these individuals have issues. So how simple would it be to reduce your risk of cardiovascular disease by simply supplementing with the appropriate B vitamin, a very cost-effective vitamin that can be quite impactful. B-rich foods, dark leafy greens, and high quality meat. So you can definitely get this from your diet as well. This picture, I found it in one of my books as I was preparing this presentation, and I thought it fit really well because it has a look at how multifactorial cardiovascular disease is. So not only can things like, of course, inflammation and diabetes and high cholesterol and obesity impact the heart, but so can the psychological things of anxiety, depression, lack of fun, lack of joy, work stress, financial stress, life stress. Even having higher levels of uric acid is not great for your cardiovascular system. Vitamins, sleep disturbances, gut issues, so having gut infections, even having periodontal disease, so gum disease, can impact the cardiovascular system. And I know majority of the patients come to me for more energy, weight loss, maybe they have digestive complaints, and cardiovascular disease doesn't seem so, not important, but it doesn't seem so front of mind because we don't feel cardiovascular disease. But because it is such a strong predictor of disease and mortality and morbidity, I'm always having a look for these markers on patients' blood work and how that we can improve it. Cholesterol levels. Again, cholesterol is not always the issue. Cholesterol is a response to the inflammation. So we have to look at the cholesterol levels in context of the patient's risk factor. Cholesterol is important for your brain, really important for cognition. Cholesterol goes into building our sex hormones, estrogen, progesterone, testosterone. So cholesterol is not all bad. Sometimes lowering cholesterol too low is not beneficial. And not every individual would need their cardiovascular or need their cholesterol levels to that point. So this is very individualized, and we have to look at the risk factor for cardiovascular disease. Most importantly, I look at HDL. This is the LDL. Sorry, HDL. This is the good cholesterol. I was reading one of your comments. HDL, the good cholesterol, I want that to be greater than 1.8. As long as that's high, that is very protective. Liver enzymes is the next thing that is often run. Liver enzymes can suggest liver inflammation. Most individuals will have normal levels of liver enzymes. If they're mildly elevated, it could be from fatty liver, or it could be from things like hepatitis if they're really, really high. Most commonly in my practice, what I see is low GGT. So low GGT is typically ignored and said it's not a big deal. But low or mildly decreased GGT can actually signify a magnesium or B6 deficiency. So have a look and see where your GGT levels are. That could provide insight onto some of those key vitamins and minerals. We can also see low GGT in hypothyroidism. So if you're not getting a full thyroid panel run and you feel like you have the thyroid symptoms and you have low GGT, then that might be a situation where you press for a full thyroid panel. Liver health is really important for the thyroid gland because about 20% of the body's T3 is delivered into your bloodstream by your thyroid gland. So we really want to look at if 20% of the active thyroid hormone is coming from the thyroid gland, where's the other 80% coming from? And the other 80% is actually made in your livers and kidneys. Gut health plays a role too, but in order to get your inactive thyroid hormone over to active, it does depend heavily on liver function. So it is important to look at, okay, what nutrients does the liver need in order to perform at its best? So things like your B vitamins, glutathione. What are some things that impair your liver function? Of course, alcohols, sugars, processed foods, medications. So we have to look at overall, are you clogging up some of the pathways? Now, there's two main pathways for liver detoxification, which we'll touch on, but we won't go into too much detail. Essentially, there is a phase 1 and a phase 2. The speed at which your body goes through phase 1 or phase 2 is genetically determined. After phase 1, you form this reactive intermediate. This guy in the center, this reactive intermediate, is unstable and it can cause all sorts of issues. So you don't want a fast phase 1 and a slow phase 2. We often see that. That's why individuals have issues detoxifying and eliminating some of their hormones like estrogen. So you can run a genetic panel to see where your phase 1 and phase 2 steps are, or a urine test called the Dutch test, which we'll go into. Thyroid panel. This is one that's really important and key to drive home that TSH is not enough. TSH, from the diagram you can see, this is the brain. TSH comes from the pituitary and tells the thyroid to make thyroid hormone. All TSH tells us is the brain is communicating with the thyroid gland. That is it. It does not tell us if the thyroid is listening. It does not tell us how much T4 and T3 the thyroid is making. TSH is the opposite of what you think. So we typically think low thyroid, hypo is going to be low values. Yes, that's low T4 and low T3. But you would actually see an elevated TSH. Now think of it this way. If you have kids and you've asked them once nicely to put on their shoes, and you just say, hey, put on your shoes. The 16th time you ask them, you're probably raising your voice. That's why TSH goes up in low thyroid function, because the brain is sensing there's not enough thyroid hormone. So TSH goes up. So this is a feedback mechanism. The brain communicates to the thyroid, hey, I'm sensing lower levels, get your butt in gear. Your thyroid produces T4. It's converted to T3, which feeds back on the brain to slow down the signal. That's why the full thyroid panel is really, really important. We also know that many individuals with thyroid issues have an autoimmune condition called Hashimoto's. This is where the immune system starts to attack the thyroid gland. We know that thyroid antibodies can be raised up to 10 years before the TSH becomes impacted. We also know that thyroid antibodies for some individuals can produce thyroid symptoms, regardless of what the other markers are. So it is important to measure those antibodies if you do have a family history of a thyroid condition or your symptoms really match hypothyroidism, which is low mood, low energy. You can see constipation, you can see irregular cycles, you can see hair loss, you could see loss of the outside of your eyebrow, resistant weight loss as well. The time you do your blood work is also really important. This was a smaller study, but it was fairly recent in 2013. And what they showed is if you were to test your thyroid gland in the afternoon between 2 and 4, 50% of the participants would not have been diagnosed with hypothyroidism. So we know morning levels of your thyroid testing is really, really important. You could miss the opportunity to diagnose and treat low thyroid function if the patient runs their blood work in the afternoon. The other question that I get is, do we measure in the morning before I take my thyroid medication or after I take my thyroid medication? And it depends on the medication that you are on. So if you are taking T3 in the form of a desiccated thyroid or a cytomel, that can suppress your TSH. So it's important to let your practitioner know. So if your TSH comes back really, really low and your T3 is normal, you could be reduced, your medication could be reduced unnecessarily. We also know that the T4 medication will not alter the TSH because it has a really long half-life. So if you're taking a T4 only medication, you probably can take it just fine. But it's always important to be consistent and speak to your doctor to know what they want to do. The other aspect with thyroid testing is individuals who take biotin. So biotin is a B vitamin that typically is in hair, skin, and nail supplementation. Could be in collagen powder, could be in protein powder, could be in energy drinks, sports drinks. If you take biotin in high enough dosages 2 days before testing, that will make your thyroid gland appear normal when it's not. So it is, again, really, really important to have a look and make sure that you are testing appropriately. What I really want to see for patients is T3 levels that are greater than 3.5, ideally greater than 4. T3 is your active thyroid hormone. TSH is not enough. TSH just tells us how the brain is communicating. Interestingly enough, we have different ranges for TSH for women who are looking to get pregnant versus not. So if your TSH is greater than 2 and you're having issues with fertility, most offices will recommend supplementing with a thyroid prescription. Now, why is that same standard not applied to all testing? I like to see a TSH in my office less than 2.5, ideally less than 2. And here it also depends on symptoms. So if the patient feels really well, their energy is good, they don't have any symptoms, then we leave it alone. Here you're seeing the thyroid antibodies being presented. This tells us if the immune system is attacking the thyroid gland. We want those to be low. There's no reason for those to be high. There's no reason for the immune system to be attacking the thyroid gland. Reverse T3, this is one marker, it wasn't here, but reverse T3 can steal away the T3. So if you're thinking of playing musical chairs, you don't really want to contribute with somebody who is stronger and faster. The stronger and faster individual is the reverse T3. Reverse T3 and T3 compete for the binding sites on the cells. Reverse T3 can make you have symptoms of hypothyroidism even if everything else is normal. And reverse T3 can go up in individuals with blood sugar issues, insulin resistance, estrogen dominance, if you're on the pill, as well as individuals under stress. Here are the optimal ranges that I like to see for lab testing. Again, it depends on how you are feeling. If you feel great, we don't want to supplement unnecessarily. These are US levels. The next slide is going to be Canadian levels. You can screenshot it or refer back to the presentation after. The question I always get asked is, what do I do if my TSH is normal, so the brain's communicating normally, the T4 is normal, but your body's not converting the T4 to the T3. That's the active thyroid hormone. Well, in that case, what you'll actually have is a raised T4 to T3 ratio. So if you have your labs, you'll simply just look at, okay, where is my T4 versus where is my T3? Are you on the right side or are you on the left side? If it's raised, you could benefit potentially from selenium and zinc. Selenium and zinc help to convert your inactive thyroid hormone to the active one. Selenium, Brazil nuts, 4 to 6, zinc, pumpkin seeds, about a tablespoon. Remember, 80% of your inactive thyroid, the T4, is converted to T3, the active, by the liver, kidneys, and the gut health. So that's why we also look at, how's your liver doing? How is your gut health doing? I get the question a lot, what if I take iodine? Is that going to be helpful? You really need to be careful with iodine, and I would suggest that if the T4 to T3 levels are on the lower end, the ratio is lower here. So feel free to screenshot this or refer back to it. Here's another representation, and the point of this slide is to show you why you need to look at everything as interconnected. So we need to look at, how is your white blood cells? Are they really low, suggesting maybe you have a chronic infection? Have you had Epstein-Barr virus or mono? Are you chronically getting sick, right? Do you have chronic infections or chronic gut infection? Is that impacting the thyroid gland? What is your nutrient status like? Do you have iron deficiency? That can impact your thyroid gland. What are your estrogen levels? That can impact it. How are your stress levels? Do we know what your cortisol levels are? Because it's not just enough to say, take this thyroid medication. Because when that happens, many individuals are disappointed thinking that thyroid medication is going to fix all their problems, and it doesn't necessarily. We have to look at all the other contributing factors. We need to take a holistic approach in order to make individuals truly feel better and not just mask their symptoms. Cortisol. Cortisol is our stress hormone. Cortisol is big. It's a huge contributor to so many different conditions, so many different reasons for the doctor's office, and cortisol follows a pattern. Cortisol should actually be high in the morning. That gives you energy to get out of bed, break down fat for fuel, time to wake up. Cortisol should be low at night. We need cortisol to come down for melatonin to go up, your sleep hormone. Now, having high levels of cortisol is really tricky to catch. It's really hard to do with blood work because of this circadian rhythm. If you test at the wrong time, then you're not going to see the spike. In addition, just getting a blood test done or getting to the lab in general, that can be stressful and doesn't always provide the best, most accurate information. This is where looking at a urine sample that you can do when you first wake up, 30 minutes later, or even a saliva test would do afternoon and midnight, that will provide better insight into the natural curve. What raises stress? I think we've got a slide on that. it's not just the mental, emotional, day-to-day stress. And I think with the current state of the world over the last 2 years, we are discounting the amount of stress we are under, even if it's, we're not consciously aware of it, because we play it off as everybody's dealing with that. Well, just because everybody's dealing with low-grade stress does not mean it's not impacting us. Individuals with cortisol issues can feel really tired when they get out of bed. They can also feel tired in the afternoon. They could feel also tired at night, but for many individuals, they get this second wind or this tired but wired in the evening where they can't fall asleep. Cortisol issues can be responsible for waking individuals up between 2 and 4 a.m. They can trigger hot flashes and make them worse. So it is really important to have a look at where the cortisol levels are and how we can improve this. Simply telling somebody to stress less is not going to do it. We have to look at, are you dehydrated? Is there stress coming from overexercise? How is your diet? What are you doing for fun? What are you doing to balance out the go, go, go? What are you doing for things that bring you joy each and every day? This is an example of the Dutch test. This is a great test to have a look at the cortisol curve because it can tell you what are your cortisol levels in the waking, the morning, the afternoon, the night. So this individual is going to feel really, really tired both at night and waking. Some get this nice rise, some don't. Some see their cortisol higher at night. Some see their cortisol spike between 2 and 4, and that's what wakes them up. Typically what happens is your blood sugar will dip in the middle of the night. That will trigger stress to bring it back up, and then that wakes you up. So that's classically what we see. And the thing is, with individuals who are going through perimenopause and menopause, you are less tolerant of stress. And unfortunately, our society is not set up to support a stress-free life. So it's really important to schedule those things in and be really clear with your boundaries. Impacts of stress. So we talked about the work stress, the nutrition stress, psychological stress. Having high blood sugar is a stress on the body. Chronic inflammation is a stress on the body. Chronic infections create stress on the body. So I see this a lot with gut infections. Individuals that have dysbiosis or a rise in harmful bacteria, that in and itself can cause inflammation that we see in the GI tract. Having food sensitivities or celiac that's undiagnosed, that will absolutely raise stress in the body. When you are stressed, all your body sees is a threat, a bear. It does not distinguish between a true threat to your physical health and the fact that you were just overwhelmed with work. High blood sugar, high blood pressure, not being able to sleep, having issues with your thyroid. Remember, stress increases that reverse T3, so your thyroid doesn't work as well. When you're stressed, you're not in rest and digest, so now you're not digesting your foods as well. Now you're having issues absorbing vitamins and minerals from the foods you eat. Maybe you have acid reflux. You can also see impaired immune functions. When you're stressed, your immune system doesn't work as well. Constipation, so you're not getting the same motility. So I really want to drive home just how important stress management is. And if you can think of one thing, maybe it's turning on a guided meditation before bed and even just falling asleep to it, or getting outside. How many individuals have not been outside in fresh air, getting exposed to natural sunlight? Being exposed to blue light. You're on this presentation. Maybe the computer screen is bright, or the iPad, or your phone. That blue light is signaling to the brain, hey, it's daytime. Well, that can really mess up your cortisol curve as well and prevent you from making melatonin, your sleep hormone. So really looking at what can I do each and every day, what is causing me stress, and how can I improve my resiliency to it? You can use things like adaptogens like ashwagandha, rhodiola, B5, B6. Those can be helpful. Magnesium can be helpful, but we really want to be cautious that we are trying not to out-supplement the stress that we just don't want to deal with. So yes, I use my relax and focus all of the time. I use the cortisol reducer all of the time. But the goal is not to use supplementation to mask a lifestyle where you really should be looking at, okay, how can I change my schedule? Cortisol and stress is the #1 cause that I see of weight gain around the midsection. Midsection weight is related to cortisol or stress and also insulin resistance. And why is that? When you are stressed, your body says, there is a bear, we need sugar in the blood so that this individual can run away. So if you're looking at, why is my blood sugar high? Why am I having insulin resistance and increased risk of type 2 diabetes? I don't eat a whole bunch of sugar. Well, what's your stress level like? Another important thing to look at. Really, really important to look at stress levels and look at insulin and blood sugar levels. Stress increases your blood sugar, increases your insulin. Insulin causes weight gain and changes to your menstrual cycle, which we're going to go into. Stress increases ghrelin, your hunger hormone, and decreases leptin. For individuals who lost weight, you will have issues with your hunger and satiety hormones for up to a year after weight loss. It takes a year for them to regulate. So if you've lost weight and now you're maintaining it, it's really important for the next year to have a look at, how can I know, knowledge is power, I know that I have issues with my hunger and satiety cues. How can I control this? So maybe looking at never, ever, ever undercut protein, never, ever, ever undercut vegetables, dark leafy greens, but also consider supplementation with the fiber. Something like the Fiberline helps to bulk up the stool, helping with the satiety. Omega-3s, so using things like fish, fatty fish, salmon would be great, or a fish oil supplementation. Higher levels of inflammation as well has been associated with leptin resistance or issues with your hunger and satiety cues. So the problem is, if you have inflammation, you're going to be more hungry, you're going to be more prone to overeating, and that is the reality, but we can manage it through diet and lifestyle. You cannot undercut your sleep either. That will make you feel hungrier. You don't want to over-exercise. That's going to make you feel hungrier. Really important to manage that. Stress decreases dopamine, your motivation hormone, serotonin, your happy hormone, lowers your thyroid. We talked about this. Lowers your immune function, your sex hormones, decreases melatonin and growth hormone. These are like highly anti-aging hormones, and increases inflammation. Abdominal weight gain, sugar cravings, high blood pressure, poor exercise tolerance, all of the signs and symptoms. A lot of these slides are repetitive with the stress because of how important I feel it is. Dehydration, something as simple as making sure you're drinking enough water each and every day, making sure you're sleeping each and every day. Free things, right? Don't get dehydrated, don't get sleep deprived, don't over-exercise. Watch on chronic yo-yo dieting. Watch if you're too low in calories. Watch if you're on your phones on TikTok late at night. I think that's where a lot of you find out about my practice. Hopefully it's not 1 a.m. when you're doing that. These are things that you can control right now. Stress creates the inflammation, the oxidative stress, impairs your mitochondria. Mitochondria are these amazing cells that help to generate ATP. ATP is energy. So if you're stressed and your mitochondria cannot work as well, you're going to feel really, really tired. Your body's not going to be able to extract the calories or the stored energy on your body. If you have extra weight, your body's not going to be able to handle that if you are under significant amounts of stress. And this is where individuals, the coaching program with regards to weight loss is so important, because if you get stressed out and you're not sleeping and you're worried about the scale, having somebody to help manage those expectations is key, or you're not going to see any changes. This is the mitochondria. This is the Krebs cycle. This is what happens inside the mitochondria for you to generate ATP. Look at how important the nutrients are. Iron is important. Magnesium is important. Your B vitamins are important. So if you are missing these nutrients, and again, you don't need them through supplementation as long as you get enough through your diet, that can make you really, really tired. The things in green here, these are amino acids. That comes from protein. The amount of individuals that are just not getting enough protein to help fuel the cycle is significant. CoQ10 is a really important nutrient for energy. It's the very last step. It's the cofactor. If you don't have this, you won't get your ATP. Statin medications are known to deplete CoQ10. That's why individuals can experience really low energy on a CoQ10 or on a statin medication, and they might experience muscle pain. So looking at, if you have to be on a statin medication, okay, but can we supplement with the nutrients that it depletes? There's a great website called MyTavin, MyTavin.com. You can type in the medication that you're on and it'll tell you the nutrients it depletes. Most commonly, we see cholesterol medications lowering CoQ10. We see SSRIs, which are typically used for anxiety or depression, that lowers melatonin, so individuals don't sleep as well. Birth control can deplete zinc, B vitamins, magnesium. Birth control pills or hormone-based birth control increases your risk of insulin resistance, unfortunately. So definitely things to consider. This is an organic acid test. This is a urine test. This can provide us insights with regards to which vitamins and minerals might be deficient. So if you're looking at this cycle and you say, okay, I want to understand which ones of these I would benefit from, the urine test can show you. I really like the urine testing for nutrients because it tells us how much of the nutrient, vitamin, or mineral actually got into the tissue and now is being excreted in the urine. If it's just in the blood, that doesn't necessarily mean that it's got into the tissue levels. This test also can tell you if there is byproducts in the urine that suggest bacterial or yeast overgrowth. It can provide us with some insight in terms of, do you need more amino acids? What are your detox pathways like? What are the levels in your brain approximately in terms of serotonin, happy hormone? What is your dopamine levels in your brains, your stress levels? So this can be a really good test to consider as well. Now we're getting into the sex hormones. So these are the estrogen, progesterone, DHEA, and testosterone. Before we dive into this, and there's not too much of the presentation left, so hang in there. I just want to review what the hormones are of a normal menstrual cycle. The urine test was called an organic acids test. The PCOS, we will be talking about DHEA coming up, and CoQ10 giving you heartburn. You might want to consider finding a CoQ10 that is dissolved in MCT oil and annatto E. That's typically better absorbed. Sometimes it's with the vegetable caps and not necessarily the gel caps. So you could consider that. With regards to the menstrual cycle, there's a couple phases. So day 1 is the first day that you bleed. So day 1, the uterine lining is shedding. Typically to day 3, 4, 5, we typically say in that range. Then we start this phase called the follicular phase. In this phase, estrogen levels will rise. Estrogen causes LH to surge. This LH surge causes you to ovulate. So if you are tracking fertility and you're using the LH strips to know when you ovulate, that's what we're looking for. So if you are trying to figure out when you ovulate in order to get pregnant, you could consider those strips. After you ovulate, we get a rise in progesterone. The only way to get a rise in progesterone is through ovulation. It is the rise and then the rapid decline in progesterone that triggers your cycle. And that's typically what we see. In terms of testing, where I test is right here, about 7 to 10 days before your next menstrual cycle, or on day 19 to 21 in there, because I want to know, did you get a rise in progesterone? And I want to know that because that suggests that you ovulated. And ovulation each and every month is so important for your mental health because progesterone's calming. It's important for preventing estrogen-dependent cancers. It's important for patients with PCOS and endometriosis. This is what we typically see in the menstrual cycle as a review. Estrogen dominance. So this is very common, something that I see in my practice. Individuals who have heavy painful periods, PMS, headaches, decreased sex drive, bloating, mood swings, fatigue, anxiety, depression, breast tenderness, endometriosis, fibroids, and hormonal-based weight gain. Now there's 2 types of estrogen dominance. One, your estrogen is just really, really high. The other type is your estrogen's high in relationship to progesterone. So we always want them balanced. Now, if there is an absolute, that means your estrogen's really, really high. Your progesterone's normal, estrogen's just really high. But it's this relative that we see more often, especially in perimenopause women, and especially in women with PCOS, where your estrogen's normal or it's high normal, but in comparison to that progesterone, because your progesterone didn't rise, it is quite high. Estrogen causes things to grow, causes the uterine lining to grow thicker, causes fibroids to grow thicker, breast tissue to grow thicker. Your legs and your glutes have estrogen receptors. So we want to make sure that you have appropriate levels of estrogen, just not too much. And we can measure that either with the Dutch test, that urine test will show the estrogen levels, or with blood work approximately before your cycle. If you have an irregular cycle or you don't know when your cycle is coming, you can test on day 20, 21 would be appropriate. What can cause estrogen dominance? Higher levels of insulin, higher levels of cortisol can contribute to estrogen dominance. We can also see, of course, if you're using estrogen replacement therapy or estrogen-based birth control, that can be an issue. Your liver detoxifies your estrogen. So you have to go through those phases. Remember, phase 1 and phase 2. So if you have poor liver function, your thyroid's not going to be as good, and you're not going to clear out your estrogen levels as efficiently. We also know that once the liver detoxifies estrogen, it's secreted into the bowels. Now, there is a particular type of bacteria that can unfortunately cause that estrogen to be recycled. We call this the estrobolome. So looking at how is the gut microbiome, and if your gut microbiome isn't optimal, that can also be a problem for your estrogen levels as well. We can see weight gain, so having higher levels of estrogen can cause weight gain, but having extra fat cells in itself, those are metabolically active. They produce extra estrogens. We also get estrogens from our environment, so be very careful with your skincare. When we're looking at prescribing hormone-based creams, it's a small pea-sized amount of cream. So if you are taking a skincare that has chemicals in it that resembles estrogen, you're putting it all over your body, that can be problematic. You might want to check out EWG, Environmental Working Group. I'll just type this in here. It's either ewg.org or .com. You can actually scan your skincare products or type them in to figure out if they are, good levels. Do they have endocrine disruptors in them? Things like that. So I would check that out. If that website's not right, can someone correct me to what it is? That would be particularly helpful. Estrogen, we know, can be related to your genetics as well. That's why we see estrogen-dependent cancers in some family members, but your genes are not your destiny. We can help mitigate some of the impacts of those genetics, but we have to know what those genetics are. Low progesterone, oh, thank you for that website. Low progesterone levels, really important to know and to treat. If you have irregular cycles, you're probably not ovulating and your progesterone's probably not coming up. Progesterone is this calm hormone. It helps to activate GABA in the brain. That's your calm, sleepy, zen hormone. If you're not feeling sleepy, zen, calm before your menstrual cycle, you really want to look at what your estrogen and progesterone levels are. Now, when it comes to perimenopause and menopause, we typically always think of, oh, it's estrogen levels declining. And yes, that is true, but we also see the decline in progesterone. And often it's the progesterone that's actually declining too much in relationship to the estrogen that is causing a lot of the symptoms that you're experiencing. Progesterone also is the progestation hormone. It helps you to get pregnant and stay pregnant. So it's really important if you are having challenges with fertility or miscarriages to see, do your progesterone levels come up enough? Individuals with PCOS, you're not ovulating, you often don't have enough progesterone, and sometimes just using a bioidentical progesterone for a couple months can help reinitiate a menstrual cycle. The other problem with this that I see, especially in PCOS women, I don't think I put this in the presentation, but higher levels of insulin, remember, go back to the blood sugar section, higher levels of insulin causes higher levels of androgens. So those are the things like the testosterone and DHEA. That causes the acne on the face, the oily skin, and the problem with that is that can actually stop you from ovulating. So now you don't get the progesterone, and your estrogen's too high compared to the progesterone. So now you have high testosterone, low progesterone, and you've got an estrogen dominance. The solution is not to say, oh my gosh, we need to give you progesterone, we need to give you spironolactone, we need to balance this all out. We have to look at what are your insulin levels and go back to what is causing all of this. If it's a blood sugar insulin issue, treat that so that the hormones can all regulate. Birth control does not fix a menstrual cycle. When you take birth control, essentially what you're doing is as soon as you stop taking the pills, you have a rapid decline in hormones, and that is a medically induced withdrawal bleed. That's not a true cycle. A true cycle comes from ovulation, which of course the pill is blocking. Menopause, we talked about seeing a decline in both estrogen and progesterone, but more often so it's that decline in the progesterone that I find that creates the most symptoms for individuals. You see irregular cycles, mood changes, sleep disruption, hot flashes, vaginal dryness, less resiliency to stress, and you're more at risk of blood sugar issues when your hormones are declining. Hormones begin to decline at age 30. It's a low decline from 30 to 35, and then typically after 35, we see a rapid decline. So that's where we start to see issues with blood sugar and resistant weight loss, and you're less resilient to stress, and you're waking up between 2 and 4 a.m. We don't want to put your hormones back to a super physiological level. We don't need hormones of a 14-year-old, but getting hormones up to optimal levels can be quite impactful for symptomatic management and prevention of chronic disease, such as osteoporosis and cardiovascular disease. Simply saying, oh, you're too young for menopause is not good enough. When we have labs that we can easily and readily availably, not that that's a word, but they're very easy to run. If you feel like you are having symptoms of perimenopause, check your hormones, estrogen, progesterone, testosterone, DHEA, FSH. When FSH is raised, that is a sign that a woman is entering perimenopause. Don't worry about stressing about writing down the lab values. At one of the last slides, you can screenshot it. It shows the requisition. Menopause, because there was a couple emails that I received prior to the presentation tonight about what you can do. Chasteberry or Vitex is one that's been shown to support progesterone, which is great. St. John's wort can be helpful for the mental emotional aspect that comes around with perimenopause and menopause, and unfortunately that's just not talked about enough. St. John's wort cannot be combined with an SSRI, so if you're on an anti-anxiety or an antidepressant medication, you cannot take those together. Sage tea, 2 to 4 cups a day, can also be helpful and impactful for hot flashes. Making sure that you're managing your blood sugar is really, really important for hot flashes. So that's why the berberine is in there. Berberine is one of my favorite herbs for lowering insulin. It can also be really helpful for women with PCOS, and it can be particularly helpful for patients who have gut issues. Intermittent fasting is also great for managing the insulin piece. Bioidentical hormones, such as a bioidentical progesterone, often can be helpful in the right patient. And fiber. Fiber is really, really helpful for helping to clear out estrogen from the bowel. So aim for 25 to 30 grams of fiber. This is an example of the Dutch test. This can be particularly helpful not only for the cortisol, so this is the one that you did the 4 urine samples throughout the day to measure your cortisol levels, but this is what I really like if we look at the estrogen piece. Estrogen is broken down blue pathway, red pathway, or green pathway. The green pathway is protective. We want this. This is why women are less likely to have cardiovascular disease than men, because they have this green OH estrogen. Individuals who go more down this red pathway are at increased risk of estrogen-dependent cancers, because it can go on to form things called quinone adducts, which damage DNA. We do not want that. We also don't want to go down the 16-OH pathway, this blue one. That makes things grow. So fibroids, fibrocystic breasts, heavy periods, headaches. You can help your body go down this blue pathway by making sure to have things like cruciferous vegetables, broccoli, kale, cauliflower, bok choy. DIM is also one that can help here. Now, there's also a study on cruciferous vegetables. Those that can consume 1 serving of cruciferous vegetables a day versus once a week are 22% less likely to die from all cause of mortality. So if you take anything away from this presentation, eat cruciferous vegetables. The other interesting aspect with this Dutch test is it tells us how your hormones, which pathways are they more likely to go down. So for an individual here that has an elevation in 5-alpha reductase, this individual, especially if they have PCOS or you supplement with testosterone, that can cause acne, It can cause facial hair, as well as hair loss on the head for this particular individual because they're more likely to go down this pathway. So if we look at really precision medicine and finding what the best possible solution is for each patient, we have to look at just saying, oh, it's a low risk. Well, who are those individuals with that low risk? When we test, we'll actually be able to tell. This is a great overview of how the hormones all interact with one another. So if you're stressed out and you have high levels of cortisol, that's going to reduce your progesterone. Progesterone is that calm zen hormone that needs to be high before your menstrual cycle. We also know that testosterone can be converted to estrogen. So if you have obesity or inflammation, insulin resistance, your testosterone is converted to estrogen. So now your sex drive is low and you can't gain lean muscle mass. Perhaps you supplement with testosterone, but maybe that's not the right solution if it's all going down this pathway. So again, hormones related to blood sugar, related to your stress, you have to look at everything in combination. Vitamin D. Vitamin D is so important. It's more so a hormone. It's important for blood pressure, blood sugar, weight management. We know individuals with vitamin D insufficiency are 2 times as likely to have longer menstrual cycles. Mental health concerns, immune system concerns. Vitamin D is one that you can overdo. It is one that if you take too much, you can reach toxic levels. So you want to always test and know what your levels are and make sure they're optimal. More is not always better. In addition, you test, depending on your levels, you supplement, but then you need to retest to know if it's come back up. If you don't retest, there are individuals that just have a hard time absorbing vitamin D supplementation, and they either need to get out in the sun more without burning, or they might need some form of injection. I cannot emphasize enough how important vitamin D is. There are so many online companies. It's going to cost you maybe anywhere from $39 to $100 for a vitamin D test. Now I want to dive in. So that was most of the blood work that I'll run. Of course, if there's autoimmune conditions, we're going to run autoimmune markers. But what I discussed was pretty much the standard of what we'll run with patients. With regards to functional testing, we talked about the organic acid testing for the nutrients. We talked about the Dutch test for the hormones. And now, over the next couple slides, I want to talk about the functional test, the stool test called the GI map. This is one of my favorite tests to run because it looks at the normal bacteria flora, so it can tell, do you need a probiotic? Which probiotic is right for you? It can tell us, are you digesting your foods? Do you have inflammation in the gut? Do you have leaky gut? And we are now knowing more and more the relationship between the gut bacteria and your hormones, the gut bacteria and your mental health, the gut bacteria and your waistline. Because I treat a lot of insulin resistance and resistant weight loss in my practice, I'm just going to highlight some of the key findings that I see on a GI map test for individuals that struggle to lose weight. What they did is they did a stool test. I'm going to flip around to this picture here. So they did a stool test and a fecal transplant. So they had 2 genetically identical rats. One was obese, one was lean, genetically the same. So the argument in terms of, well, weight gain is all genetically determined. Genetics do play a role, absolutely, but it's not the full picture. They took the feces from the obese rat and transferred it into the lean rat. Why? I don't know. Now they do it in humans, which is interesting. The lean rat did not change its diet or lifestyle, but that lean rat became obese just by the fecal transplant, which led them to say, okay, why is that? What was the key differences between the individual's gut microbiome? And from that study, we know that there are particular bacteria, such as Clostridia, that are really important for weight management. When Clostridia is high, it's linked to metabolic dysfunction, meaning issues with inflammation, insulin resistance, cholesterol issues. We also know when Clostridia is low, we're more likely to see inflammation and autoimmune conditions. So individuals with IBD, Crohn's or colitis, individuals with lupus, rheumatoid arthritis, Hashimoto's, Graves', thyroid conditions, there is a key impact on autoimmune conditions in the gut microbiome because so much of our immune system lives in the gut. When Clostridia is high, we know that this type of bacteria produces something called beta-glucuronidase. Beta-glucuronidase is what is responsible for that estrogen recycling. So remember, your liver detoxifies the estrogen that your body makes and the estrogen from your environment. Great, it's detoxified, it goes into the bowels. The problem is if you have the wrong type of bacteria producing the beta-glucuronidase, that estrogen will be recycled. So now you have to go through the detoxification process again. So that's where the gut health comes into not only weight, but also autoimmune conditions and hormone-related concerns. Akkermansia mucophylla is one of my other favorite bacteria. And I put this little Pac-Man here because this bacteria, mucinophila, means mucus loving. So this bacteria will go around and it'll start to break down the mucus lining in the gut. Why is this important? Well, Akkermansia is a messy eater and it leaves crumbs lying around. Not all the bacteria can eat away at the mucus for a fuel source. So Akkermansia does it and leaves the crumbs for the other guys to survive. So it is one that all the other bacteria, or a lot of the other bacteria, do rely on. Now, research has shown individuals with low levels of Akkermansia, we see insulin resistance, so weight gain, resistant weight loss, blood sugar issues, type 2 diabetes, and inflammation. Not a good thing. We know individuals who are on high-fat diets, and we have to discuss like unhealthy high fat versus healthy higher fats, not the same. So an unhealthy high fat diet and high alcohol consumption will lower Akkermansia. When you have inflammation in your body, that will lower Akkermansia. So now you're going to start absorbing more calories from the foods you eat, and your storage signal is always going to be on. So this can be a contributing factor to why two individuals can eat the same and produce different responses, or why 2 years ago could I get away with eating these things, but now I can't. It's not always one thing. So it's not always just the gut microbiome. It's typically this interconnected, complex function that we have to look at everything. Akkermansia mucinophila, there's an inverse relationship. You actually want more of it. You don't want less of it. So in order to get more of it, you have to look at why is it low in the first place? So maybe it's low because of inflammation. Maybe you were doing an unhealthy ketogenic diet where you were deep frying all of your cheese and wrapping it in bacon and cream cheese. Probably not the best bet. Or maybe you have to look at how much alcohol are you actually consuming. Interestingly enough, there are some ways to boost Akkermansia. We know that berberine can increase it, the drug metformin can increase it, and a very specific bacteria called Bifidobacterium B420 is the particular type of bacteria shown to increase Akkermansia. So treatment, reduce the inflammation, berberine, metformin, omega-3s, polyphenols, so making sure there's an abundance of fruits and vegetables in your diet, intermittent fasting, caloric restriction, weight loss, all of that can support Akkermansia. This is one you want. This is the good guy. Akkermansia mucinophila is the Pac-Man, provides food for other people. This is the good one. You want this one. So that's the opposite of the Clostridia. This one you do want. Low levels of Akkermansia I see all the time in my practice. This is why I created the tummy tone that has the bacteria in it to raise Akkermansia, as well as the fibrillin is the fiber to help support it. There is also one more aspect of the gut testing, the GI map, that contributes to caloric extraction from the foods you eat. We know that we can take the bacteria and group them into 1 to 2 classifications. I think my camera is turned off here. So all of the bacteria will fall either into Firmicutes or Bacteroides based off of how they look. So the same way we would take animals and say, okay, you can fall into dog or you can fall into cat, and there's all the different species in those categories. That's what we do with the bacteria. And the ratio between the two we know is really important for weight management. If the ratio is high, we see more calories being extracted from the foods you eat, impaired insulin sensitivity, more inflammation, more weight gain. The problem with traditional probiotics, so you go to the store, you heard probiotics are great for you. Yes, they are, but it's the particular type for the particular person for the right reason. So ideally, we would run stool tests on everyone. We would say, okay, here's what you need based off of your testing. Now, the problem with just going to the health food store and grabbing a probiotic is lactobacillus, in particular, raises this ratio. And if your ratio is always already high and you're already more prone to resistant weight loss, you don't want lactobacillus. That will raise this ratio. So it's really important to look at bifido-based probiotics. Now, bifidobacterium B420 is the one that I use because it has research on weight loss in particular, but you don't have to buy my probiotic. Sometimes individuals get upset if I'm mentioning supplements, and my website, go on the website, download the tech sheets. It will say exactly what's in the product, and you can look for that exact same product in another supplement. So the tummy tone is the bifidobacterium B420. It's all linked there. The other way that we can help manage this ratio is by berberine. Berberine helps with insulin resistance. It's helpful for women with PCOS. It's helpful for weight loss. It's helpful for type 2 diabetes, and it's antimicrobial. So sometimes bacterial get overgrowing, right? So there's particular types of the ones that aren't so great that can overgrow. Berberine can help with that. So I'd say berberine and tummy tone are my favorites. Where to order? If you're looking for blood work, there are many options. If you're in the US, you can order whatever blood work you want. There are some states that are excluded, but they're few and far between. Yourlabwork.com, you can get access to anything. You just pay, download your requisition, pop into the lab. If you are in Ontario, if you are in Saskatchewan, if you are in BC, if you are in Alberta, you can have a naturopathic doctor, a functional medicine doctor, a nurse practitioner, or a medical doctor run these labs. Dutch tests, organic acids tests, the GI map, those are functional medicine tests. Typically, it's going to be with a functional medicine doctor, a naturopathic doctor, but they are available online as well. The GI map test will tell you if you actually need a digestive enzyme or not. So we talked about the Dutch test. This is for hormones and how they interact together. This is better for the cortisol curve because, of course, doing 4 urine samples or 4 of the saliva samples is much easier to do than 4 blood work. If you are like, what do I need? What do you typically test? In general, this is my male and female. You can't print this off and take it to a lab. There's no information on it. They won't accept you to do that. But this will give you an idea of what my requisitions would look like. And then I add or subtract for individuals based off of their health condition. The best thing to do is really work with a practitioner to understand what would even be impactful for you to run, what is needed, what more do you, based off of your signs and symptoms. If an individual is on a hormone-based birth control, I won't measure the estrogen and progesterone because it's just going to show that you're on birth control and we don't want to interfere with the effectiveness of it. So there are some caveats. You can screenshot that. If you're wanting these pictures, you can email my office. We're happy to send them over. Now, this is the part in the presentation where I'm going to shift over into anybody who's interested to working together, wondering how perhaps you can become a patient or you can become part of the Metabolic Reset program. Happy to review that. It's just really quick. And then any questions that you have, feel free to post them in the comment section. I'm happy to take questions here as well. In terms of Texas, if we needed access to functional medicine testing, it would just be shipped out to you. You can access a Quest lab in Texas through yourlabwork.com. It's very easy in the US for you to order all of your own testing, which is a little bit different in Canada. So in terms of the services that we offer, I offer one-on-one patient appointments, health consultations. Typically that appointment will take an hour to an hour and a half. We'll review your health history. We'll discuss, here's what I think's going on. Here's the testing that I feel would be best for you. And we go from there. Each appointment is different based off of the individual's need. Typically, the first appointment is looking at diet and lifestyle. If you already have lab testing done, my goal is to review that so you understand what each and every level means and is it optimal for you. We might run more tests, we might change your diet, we might talk about treatment options. We also have the Metabolic Reset Program. So the Metabolic Reset Program is a 10-week program designed for individuals who have inflammation, insulin resistance, cortisol issues, low energy, weight loss resistance. My dog is dreaming. Must be late. Okay, we're gonna wrap it up. The Metabolic Reset Program, most individuals will lose 20 to 40 pounds in 6 weeks, and we also work with you one-on-one for the mindset coaching. The mindset coaching is so key for weight loss. We also have a mandatory maintenance part of that program. So we teach you how to maintain the weight. We hold you accountable. We help you find a lifestyle that you love. The idea of the program is to look at all of the things we talked about today, the blood sugar, the inflammation, the food sensitivities, the cortisol, the sleep, optimize all of those things for you so weight loss becomes easy. So it's not just about the nutrition, it's kind of everything else, which I hope you got that from the presentation today. Questions. What would you recommend as a treatment for IBS-D? So for IBS means essentially we've ruled everything else out and we're calling it irritable bowel syndrome. Now, we do know that 80 to 90% of irritable bowel syndrome, while the actual intestinal cells, you don't have irritable bowel disease, they're not inflamed, there's not damage going on, but the gut microbiome is vastly different. Majority of the individuals with IBS actually have dysbiosis or bacterial overgrowth. We call this small intestinal bacterial overgrowth. So running the GI map can be particularly helpful. Once those bacterial imbalances are treated, symptoms will get better. Now, sometimes leaky gut could also contribute or elevated zonulin levels. The GI map will measure that and we can treat that. For some individuals with IBS, they're having a really hard time digesting their foods. So they perhaps don't have good stomach acidity and they're not producing good digestive enzymes. And then those undigested food particles are irritating. Maybe you just need a digestive enzyme. Some individuals with IBS have never been tested for celiac or gluten sensitivity. The GI map test can test that as well. So there's no one size fits all solution. But I do like the GI map test for IBS because we do see changes on that test and we can absolutely treat it and make it better. The GI map test also, I think sometimes individuals with IBS, IBD, Crohn's or colitis really hasn't been 100% ruled out. It's just, based off of your symptoms, we think you have IBS. IBD needs to be ruled out. You need to have a calprotectin levels. I've had a number of patients who were told they had IBS based off of their symptoms. They didn't actually have proper testing done. It turns out they had either Crohn's or colitis. Kidney stones is a really tricky one. So it depends on the type of stone, and I would look at your calcium and magnesium levels, and it depends, are those stones even causing any issues or were they just found incidentally? Kidney stones would be one that you would want to work with your primary care for, especially if they were causing issues or damage to your kidneys. There's another question here about lower levels of white blood cells. If we go back to the first page, white blood cells is one that can be problematic when they're low, right? So when we look at the concerns that we have, there are higher concerns when individuals do have those chronically low white blood cells. Sometimes they're so low that we need to look at, is the bone marrow producing white blood cells? And that of course would not be with me, that would be with a specialist who would have a look at that. Other reasons why they could be low, maybe it's a chronic illness or a chronic infection, which now your white blood cells are just depleted, you're not able to fight it off. So looking at potentially Epstein-Barr virus, EBV, or past mono infection, maybe Lyme would be another one to have a look at. Autoimmune conditions, so running some autoimmune markers, maybe an ANA. Do you have joint pain, right? Could it be rheumatoid arthritis? Things like that. The Metabolic Reset Program can be fantastic for individuals with thyroid because remember, your inactive thyroid hormone, the T4, needs to be converted to your active T3. Where does that happen? Liver, right? So we're supporting liver detoxification in the program. Also, insulin resistance makes the thyroid not work as well. Some of those other factors, like the stress, we're dealing with that. Now, I'm going to caveat that with the metabolic reset program. We are not giving thyroid prescriptions. We are not supplementing with thyroid hormones for anybody on that program. So if your thyroid has not been treated, you need to get treatment, right? Like the metabolic reset program is not a secondary option, or you can't just do the reset program and not take your medications. Individuals who are on thyroid medications, we welcome you to the program. And the key is you need to be on board with repeating your testing, because your need for thyroid hormones might change, right? So you lose 20 to 40 pounds, you're probably going to need your blood work done to make sure that your medication is appropriate. Hope that makes sense. Individuals with gallstones, hypothyroidism, and high levels of estrogen, those typically all go together. So when you have low thyroid function, what we typically see is low motility. So that bile starts to get stuck, and the bile in the gallbladder becomes thicker or more viscous and increases the risk of developing stones. When you have higher levels of estrogen, we see more risk of gallstones and more risk of lower thyroid function. So perhaps I would look at maybe there's an estrogen dominance piece there that needs to be treated. The metabolic reset program includes everything you need for the 10 weeks, your supplementation and your coaching. It does not include labs and customization. If you had labs and you wanted me to review it and customize the program for you, that's absolutely an option. If there is, my coaches are really, really good. They've been working with me for a prolonged period of time. If they feel like something is needed, they always get in contact with me. If they feel like a supplement's needed to add on, they absolutely will do that. The program aims at addressing the most important things, which is the inflammation, the cortisol, the hormone piece, the liver detoxification, the gut health, right? And it's in a way that's very structured and takes the decision making out of it. So much of food and supplementation is just overwhelming, and I don't know what to do. I don't know what to decide. So it is very structured. And we teach you through the losing phase how to lose. That part's actually the easiest part. But then we coach you in the maintenance part, how to add foods back in. So we actually try to identify, was there a healthy food that was creating inflammation for you and causing an issue? Now, the nutrition piece, I would say, is very similar to perhaps an autoimmune paleo nutrition plan or an anti-inflammatory nutrition plan. So having a look at, maybe eliminating the foods that are more likely to cause inflammation at the start. Not everybody is sensitive to gluten, dairy, soy, egg. We have to figure out what for you is the issue, right? I see a lot of people being like, you need to be soy-free, gluten-free, dairy-free, this free, this free. And it's like, well, no, how do you feel on those foods? So we eliminate them and then put them back in. You are able to book an appointment with me directly. My patient care coordinator, Allison, is fantastic. Her contact information is there. For the reset program, we do need to have a consult first. So the program is not always right for each and every individual. We want to make sure that it's a good fit for you and for the coaches. So if you go onto the website, there is a button for the metabolic reset program. So this is just myname.com, breannkallonen.com. There is a sign-up page for the metabolic reset program or health consult with me. The reset program, you can talk to the coaches. There's videos on the website as well if you want to have a look at what some of the others are saying and go from there. There's a great question here. I already eat grain-free, dairy-free, and need to stay that way? Of course. So if you already know that you have sensitivities to particular foods, of course you wouldn't add those back in maintenance, right? So especially for somebody who has celiac, we would never say, okay, add gluten back in. Of course not. And the other great part about the program is, for instance, if you see and you find out that you are sensitive to some of these foods, what we'll do is we'll work with you to determine, is it once a week that you can have these foods? Would a digestive enzyme be appropriate when you had those foods? How can we make this sustainable and enjoyable for you, right? And then we also talk about, okay, we know, again, from what I said with the hunger and satiety hormones, you're at a high risk of regaining that weight for a year after. So what are we going to do in terms of ensuring that we are managing those hunger and satiety hormones and managing your inflammation and your insulin resistance so this weight doesn't come back? It's not easy. It's definitely not easy, but once your body's able to tap into its own fat for fuel and you have that metabolic flexibility and your gut health is fixed and your liver is fixed, you will be able to have more of that metabolic flexibility. You can absolutely do the reset program with intermittent fasting. So the reset program, we do recommend intermittent fasting with it. In the maintenance phase, if you don't want to do intermittent fasting anymore, you add in your third meal. You can have your breakfast. It's all about creating the plan for the individual. And the reset program too, if anybody's in the reset program right now, if you're not feeling well, if something's not working for you, we're not just going to say like, okay, sorry, you're not following the plan. We're going to make it work for you, right? So the goal is not to make you feel unwell. We have a variety of different supplementation in there that we can move around to really help support you. If you had labs done in October, do you need to have them done again? It just depends on what those labs say. So for instance, if someone has issues with their blood sugar or issues with their iron, I'm not going to repeat for 3 months. Once we have things stable and things are in optimal range, then we move out to once a year, right? So it depends on what was run and if it was optimal or not. Sorry, that's not more helpful. Okay, guys, I'm going to pop off for now. And any additional questions that you have, feel free to contact my office. You're going to get a recording within 24 hours. There's also going to be a discount code for the website too. If you order products or you want to try something out, there's a discount code for attending. Any follow-up questions, there'll be a link to my office. We're happy to help with any particular questions. I post a lot on Instagram. I post a lot on TikTok. So if there's anything that you want to see content-wise, just send me over a message there. I'm happy to make it. And thanks everybody for joining. I hope that was helpful, and we'll talk soon.